Hello everyone, welcome back to my channel. Today we are going to talk about Usmle, that is United States Medical Licensing Exam. It is a 3-step procedure that tests you against basic and clinical subjects. And there are 2 types of boards that are responsible for conduction of this examination. For the medical students who are from US and Canada, the board which is responsible is NBME, that is National Board of Medical Examination. For IMGs, that is students who are studying or who have graduated from different part of the world other than US and Canada. The board responsible for IMGs is ECFMG. Now IMG stands for International Medical Graduates and ECFMG stands for Educational Commission for Foreign Medical Graduates. Now this is a 3-step program. We are going to talk in detail about that. Step 1, the application fee for the students from US and Canada is $610. For IMGs, it's $910 plus $150. $150 extra you have to pay because this board will courier your examination paper to your country. Now I think most of the countries are eligible for this Usmle examination. You can give that exam from that country. But Ukraine is prohibited. So you have to go back to India if you're studying in Ukraine to give this exam. Now whenever you apply for step 1, there is an eligibility period of 3 months in which you have to choose one date and you can give examination. But due to some circumstances, you have to extend that eligibility period. You'll pay $70. And if those 3 months are over and you could not give that exam, then you have to reschedule the examination. That will be $500. It is an 8-hour long examination. Theoretical questions will come, MCQs. There will be 7 blocks of questions. One block will be 60 minutes and one block will consist of 40 questions. So the total number of questions will be 280. Now the qualification score for step 1 is 192. If you get 192, you qualify. And the average score for 2017-18 was approximately 225 to 230, I guess. You cannot give this examination once you pass it. You cannot reappear for it. You have to wait for 7 years and then only you will be able to reappear. But if you fail, you get below 192, then you can give it again after 3 months. You have to apply and do the whole procedure again. Now the subjects that are tested for step 1 are microbiology, pharmacology, biostatistics, pathology, biochemistry, anatomy, physiology, and behavioral science. Now there are some sub-subjects also that are tested: nutrition, aging, and genetics. Now because I am studying in Ukraine, so these are the subjects that we studied from 1st to 3rd year. As far as Indians are concerned, I think they finish this subject within first 2 years. So it depends upon your university and the area you are studying in. So you can basically give step 1 after 3 years of education in Ukraine. For step 2, CK. Now step 2 is divided into 2. CK and CS. CK is clinical knowledge, whereas CS is clinical skills. In clinical knowledge, it is basically a theoretical, more of MCQ type of examination, whereas CS is doctor to patient examination. Step 2 CK, the prices are same here. $610 for US and Canadian people, $910 plus $150 for IMGs, $70 for extension, and $600 for rescheduling. This is a 9-hour long exam, 60 minutes per block, and you have total number of questions 350. The qualification score here is 209. Now the same rule applies as of step 1. You cannot reappear for the exam once you have passed. This is more patient-centered, that the test will examine you on the basis of your clinical skills, how you are able to diagnose a certain disease, and how you will prevent that or how you will treat a certain type of clinical case. For step 2 CS, you'll have to go to USA. Now step 1 and step 2 CK you can give in any part of the world apart from some countries that are prohibited. But step 2 CS you have to travel to USA and give the examination there. You'll get 12 patients and you'll be tested on communication skills, English proficiency, and clinical encounter. So you must be very good at speaking, at communication with the patients. You must know how to basically talk to a patient, how to get their clinical history, how to prescribe a treatment, how to diagnose a certain disease. For step 3, you do not need to worry about right now, because this one comes after matching. Now matching is, once you are done with step 1, step 2 CK and step 2 CS, you will apply in certain hospitals in certain university to start your residency. That is what we call matching. You'll give some interviews, you'll put your step 1 scores in front of them, you'll put whatever research papers you have, whatever you have done in your education life, and then they'll select you on the basis of that. So that is matching. You get into residency and then the fellowship follows. Now this exam can only be done in USA again. So step 2 CS and step 3 must be done in USA. The results for this exam comes after 3 to 4 weeks. Most probably every Wednesday. But for example, due to some problem, the result came after 6 months or 3 months. So it might depend upon your personal case. You have to contact your board for that. You can also get your score rechecked, but that is $80. So this is basically about the program. You must know about these information. One point I forgot to mention was, in step 2 CK, the subjects are such as obs and gynae, pediatrics and internal medicine, like more clinical subjects. Whereas step 1 is more basic, whatever you study during initial year of your medical education. Now let's continue to the second part of the video. That is, most of the people are not aware of, or most of the people get confused in. I personally didn't had any idea about this certain steps. So I would like you to know. For the process part, first of all, in whichever part of the world you are studying, you must check your medical school. You must go to the World Directory of Medical School. You should check whether your college, university or school is eligible for giving USMLE. There are certain universities all over the world that are prohibited from giving this examination. So if you are thinking to give USMLE, first of all check the name of your university in the World Directory of Medical School. All the links that are required, I'll put it in the description box below. So make sure you go and check that. So once you have decided to give USMLE, you'll check your university eligibility. Then the second step would be to get your transcript from medical school. Transcript is basically like a report card we used to get up until 12th or our high school. So you'll get your score cards from your medical school. You'll get your marks. Let's say a person is applying for step 1 after 3rd year of their education, medical education. So you'll get your marks from 1st to 3rd year, and you'll call them transcripts. You must get them from your medical school. The third step would be to apply for ECFMG. ECFMG was Educational Commission for Foreign Medical Graduate. You must apply for that. I'll put the link in the description box below again. You must get an identification number from them after application. Now transcripts are required to apply in ECFMG. The cost is around $80 for now. It might increase in future. So you must keep a regular check on the site. The fourth step will be to fill form 186. This is a form which is available online. You must get the identification number form signed by your dean. And then you should get it notified. And after all this procedure, you'll send the documents back to ECFMG. Now this steps means you are certified student of your medical school. This step is basically to get a certification, to get a verification. The fifth step will be, after you are done with the ECFMG, you'll apply for step 1. You'll get your eligibility period of 3 months. You'll choose a date. You'll give step 1. Now, approximately 11 to 12 months are required for preparation, but it might depend upon every individual. You might need 3 months. You might need 1.5 years. So plan ahead and apply for step 1. You'll get your results after a month. After you're done with step 1, you'll think about UCSC. Now, there are certain people who don't know about this step. Apart from step 1, step 2 and step 3, this is another part which is very, very important for you to get a residency in USA. What is UCSC? USCE, United States Clinical Experience. Now, this is your exposure to patients in USA. You need to understand how the hospital works in United States, how do you talk to patients, how certain things works in United States. So you must be exposed to that part. For this step, you must come back to 7th one. You must follow these steps to get UCSC. You must give your TOEFL exam, that is the English linguistic examination. You must get vaccinated against certain diseases. Then you choose some hospitals for USCE. Now USCE is 2 types. Externship, clerkship, sub-internship, that is hands-on. The another one is hands-down, or observership and research. Now observership and research are not that important, like they don't pay certain value in your USMLE examination or your residency. But if you have done an externship, clerkship and sub-internship, it will play a very important role for you to get into residency. Apart from steps, you must finish for let's say 2 weeks to 6 months of USCE. Once you have done this one, your chances of getting into residency in USA will be higher. So observership and research is, you'll just observe a certain doctor in certain branch, and that won't give you much exposure. You won't be able to talk to patients, you won't be able to diagnose anyone. You'll just observe as an individual. But for externship, clerkship and sub-internship, you'll go to USA, stay there for let's say for a month. You'll have clinical exposure, you'll talk to patients, you'll understand the whole system, how it works, and you'll be exposed to clinical diseases and how things work. So this one, you should keep in mind that USCE can only be taken in final year. In Ukraine, in 6th year, you must go to USA. For Indians, you must go after your 4th year or during internship. So this must be taken in the final year. You will apply for USCE. I'll have another video which will explain about this in detail. And you'll wait for your application to get accepted. The 9th step would be, after you have applied for this experience, you'll apply for US visa. You'll have to prepare some documents. You must have a certain amount of money in your bank. I think you must contact an agent for this purpose. Prepare your documents and apply for US visa. Once you have got US visa, you'll go to America, finish your USCE. Now your university might not give you, let's say, 2 months free time. So you have to plan accordingly. You can go there in summer vacation or winter vacation. So you must have a plan before you even start thinking about giving USMLE. After you have done USCE, you can apply for step 2. Now this process must be done this way. But let's say you are in 5th year and you got to know about this information now. What you can do is prepare well for TOEFL, get vaccinated, apply for USCE in 5th year. You have to apply like 6 months or an year. Because so many applicants are applying in the universities and hospitals. It takes about at least 6 months to 1 year for you to get accepted in any US hospital. You should plan ahead. Give it in 5th year, apply it in 5th year, go there in 6th year. After your graduation, give step 1, step 2, and thus the process follows. Now for USCE, I'll give you just an estimation. Now this may vary from person to person and from cities in USA, different cities. For example, Chicago and New York are one of the most expensive places there. So it depends upon where you are applying. The tickets from, let's say, India to USA will be about $1,000. Food and accommodation for 4 weeks will cost you $1,000. The application fees. Now there are 2 type of experiences. One where you get free application, you apply for free and wait for a year. Or you can have an application fee of $2,000. Now good universities like Harvard Universities or Cleveland or Mayo Clinic takes higher amount of money from you to get experience there. That would be around $2,000. Maybe depending upon $1,000 to $2,000. There are certain university which gives you the clinical experience without any application fee and also provide you accommodation, but then the chances are very few that you'll get accepted into those. And there you can classify USCE into 3 types. First, the hospital that require you to have a good step 1. You must give step 1 before even applying for USCE in USA. The second one is you need to give both TOEFL and step 1. The third category, in which you don't need to give either TOEFL or step 1, you can just go directly there and finish your clinical experience. Now this is all about this video. I might have skipped some points. I'll try to make another video in continuation to cover that. Whatever questions you have, drop them down in the comment section below and I'll get back to you. Thank you.